Thank you for joining us for this live conversation on colon health. March is Colorectal Cancer Awareness Month, so today we've brought in Dr. Heather Bittner Fagan to discuss the topic. Dr. Bittner Fagan is coming to us live from our primary care at Darley Green location in Claymont. Dr. Bittner Fagan, thank you so much for joining us today.
Thank you so much for having me. I'm really happy to have this opportunity. As a primary care physician and a researcher, colorectal cancer screening is a topic that is very near and dear to my heart. And as you know, we were talking a little bit before we went on live, colorectal cancer is actually the third most common cancer diagnosed in the United States. And unfortunately, also the third most common cancer killer in the United States. But the good news is that we have great ways to screen for this and to prevent it.
Great, so let's get into a few of those details. You mentioned it's the third largest, diagnosed cancer in the United States, but it doesn't seem like it's one of those big ones, like breast cancer and the ones that people are really talking about. Why do you think that is?
It's interesting. I often find that patients are surprised when I talk about, how common colorectal cancer screening is, how common colorectal cancer is, and how important screening is. Possibly one part of it is a stigma that exists sort of associated with talking about the colon. And the other is, breast cancer is a good example where a lot of lay people out in the world have really taken on an advocacy role for the cancer to make people aware of it. There's lots of races and, sort of the pink ribbons that, are out there and much more visual.
Absolutely. So let's start talking about colon cancer more by starting with this live here in this conversation. What should people be aware of? What symptoms should they keep in mind that may be colon cancer?
So whenever a patient has, weight loss that they didn't, intend, I would urge you to talk to your doctor about that. Black, bloody stools, any kind of change in your stools, belly pain that you don't have a good reason for. These are all things that you should bring to your physician to evaluate for possibly colorectal or even other possible types of cancer.
And then what happens then? You talk to your doctor. What does the screening process look like? What if you are thinking at home, I may have these symptoms, what are those next steps?
So, depending on the symptoms that you bring to your doctor, they're going to initiate what we call a diagnostic workup. So that would be hard to kind of make a broad generalization because it'll really depend on, a lot of information about your personal history and how exactly that you presented. But what is fairly, standard and routine for patients is what we tell them about colorectal cancer screening in general. So in asymptomatic people, there are several options to choose from for screening for colorectal cancer. And to make it simple for my patients, I always put them into two buckets. There's ways that we can visualize your colon, like take a look at it. And there's ways that we can test your stool. So basically tests that you would do on your poop at home in order to give us a clue whether or not you might have cancer.
So it's not just a colonoscopy. That's not the only answer there.
It is not the only answer. And I think that's really a great question and an important question. I think sometimes patients hear colonoscopy, and if they're afraid of that, they don't even initiate the conversation with their physician. So it's super important to know that there are these other options. Now, a lot of physicians, myself included, do prefer colonoscopy, and I'll tell you why. Colonoscopy allows us the opportunity for primary prevention. Most colon cancer comes from polyps, and if you're doing a colonoscopy, you can see and remove that polyp before it ever becomes cancer. So it's really one of the great victories of medicine to be able to do that. However, you can't deny that patients are scared to go to a procedure like that. For some people, it seems very invasive, and they're just not ready to take that step. So the tests that we do on stool are also really great tests. And so I try to make sure that all my patients understand that those are options too. Now, there's an important caveat. If you do one of the stool blood tests and it comes back positive, then you do have to follow up with a colonoscopy, because that gives a hint that there's something wrong. For some reason, there's either blood or DNA in your stool that really shouldn't be there, and we have to figure out why. But if it's negative, depending on the test that you choose, you can be kind of good, signed off on for a year to 3 years.
And let's talk about age. We have two questions that came in from our viewers, both asking, they're originally hearing first screening at 50, now they're hearing 45. What is the real recommendation?
So, that is a great question too, and really, sort of pertinent for the times. So the American Cancer Society, really in the past year, maybe a little bit more, back than that, they began recommending screening for colorectal cancer at age 45. However, other experts, namely the U.S. Preventative Services Task Force, still has not changed their recommendation, and they still recommend starting at 50. So it causes confusion for patients, and frankly, it causes confusion for physicians too. So looking at that data, we know that we've seen a shift in the United States. People are getting colorectal cancer younger, and there's really good science to support that earlier start of screening. So personally, when patients ask me, well, Dr. Fagan, what do you do? What do you recommend? I say 45. I think that's where the best science is. But again, everything has a big but with it. When there's these discrepancy in recommendations, that usually means there's a discrepancy in how insurers will pay. So if you're going to start screening at age 45, or basically under the age of 50, then you really should talk to your insurance first to see if they cover this benefit. And even if they don't, I would say give them a call, because it's a way to advocate for that earlier screening that could save lives. And if you have a family history, then you're not like normal population. You need to talk to a doctor or someone in the genetics department to really understand. You may really even need to screen earlier.
So if you have a family history but no apparent symptoms, do you think you should still screen earlier, even earlier than 45?
Potentially. It absolutely depends on that family history. Who had it, when they had it, what age they were, whether or not there are other cancers associated. And sometimes I really do urge people to talk to a professional about that, because sometimes cancers that you don't even think would count kind of count towards increasing your risk. Now, we do have a tool that you should be able to see in the comments. And if you go into that tool, it guides you through some of those questions to help you with your risk. And if you agree to it at the end, there's a nurse navigator who will contact you. And if it sounds like you're someone who needs to work with a genetic counselor, they can help you with that too.
Absolutely. That is our ChristianaCare risk assessment on our website, and we will put that link in the comments. So if any of you watching are interested in taking that risk assessment, it'll be available for you in the comments. Now, Dr. Bittner Fagan, what can we do to prevent colon cancer? What should we be doing day to day to decrease our risk?
The good news is there's just a lot of things that we can do day to day to decrease our risk. The bad news is the things that probably a lot of us are already struggling to do. So you want to eat a diet that is healthy. And by healthy specifically for colon risk, you want to have a diet that's high in whole grains and whole foods. So fruits, vegetables, and really limiting those processed foods. And of course, like all things, physical activity, maintaining a healthy BMI are crucially important to preventing cancer.
Absolutely. The things that seem so simple, but are also absolutely so important.
Yes, easily said, and we all acknowledge hard to do, but well worth the effort.
And what is something that the public should know about colon cancer that you think is not discussed enough?
Well, we touched on some of those things. I mean, I think first of all, that it's really common. Secondly, that you should consider screening earlier. And, finally, that there's a choice. If you're not quite ready for the colonoscopy, there is this choice of, doing a stool blood test, and they're really pretty easy. The other thing I would say is there's a lot of like folklore out there. I have a lot of patients that say, oh, I heard that the preparation for a colonoscopy is absolutely terrible. But in truth, most of the patients who do the prep say that it's not that bad. And certainly the procedure itself, you're getting medicine to kind of make it a relaxing, moment. It's not that bad. In the old days, I think some of the experiences that patients had may have not been quite so nice or good. But I really think that, my experience, especially with the doctors at Christiana, I mean, we've got it down. It's really not this big scary experience that you may have heard about from friends that did it 15, 20 years ago.
We do have a viewer comment that goes right off of what you just talked about. She's asking if you're sedated during a colonoscopy and if you feel it happening, or if it's more like wisdom teeth when you really never know it happened.
It's more like the wisdom teeth, I guess. I don't remember my wisdom teeth. You are sedated. In fact, it's a really common experience that people wake up, feeling kind of like a little happy sedated and not exactly even believing that this thing happened to them.
And what is the one thing that you say to patients who are, concerned about it? If you have a patient who's going in for a colonoscopy, what is your go-to that you say to them to make them feel better about it?
Well, it's not very scientific, but I usually, say to patients things along the lines of, if you were my husband or my father or my mom, this is what I would have you do. And I think to patients that, that can often, kind of, touch a bone, that I'm not asking them to do something, sort of crazy. I'm not asking them to do something that really is about, I don't know, creating, profit for anyone. And the other thing that I tell people, there's so much that we do in medicine where we're struggling to know the science. Is the science good? Is this is this the correct decision for the person in front of me? The science for screening for colorectal cancer is crystal clear. Doing this saves people's lives, and there are good choices. So, if you are scared of starting with the colonoscopy, then do the other choice, and we even down in the comments, we have a tool that you can work through from our health library that'll help you kind of figure out, should I start with colonoscopy or should I start with this other test? So the best test is the test that people will do. And in this case, I really try to get people to do something rather than nothing. Don't be so scared that you do nothing and miss this really important opportunity for prevention.
And if someone knows that they're either, behind schedule for a colonoscopy or need to get their first one, what should they do? Should they talk to their primary care physician?
Absolutely. Absolutely. Come on in and talk to us. Christiana is open for business. We can do it virtually if you have some trepidation about, face-to-face visits during COVID. If you've done one of the other types of tests before and you're, fairly certain that, I'm going to do the same thing. I know what I want to do. I don't need to have a conversation. For the most part, you can just reach out via like the portal or other ways, and we're happy to help you, do that without having you, come in for a visit.
And if you are a new patient to ChristianaCare and have not taken opportunity of our services, they can visit our website, correct? It's all right there.
It's all right there. And if you're a new patient, I definitely would say come on in, because there's probably more than colorectal cancer screening on your to-do list. So we can help you kind of navigate prevention and prioritize what makes sense for you in terms of first steps. So
while I have you, I know you are a primary care physician at our Dartley Green location. So give our viewers a little bit of a peek on how you are making sure everyone is staying safe in that brand new, beautiful building of yours and that practice and having in-person care.
Sure. So for us, it's been kind of easy. We just moved from a much smaller space right down the street to this new, big, beautiful office. So number one, we have a ton of space. So, we're able to direct foot traffic so that people, coming in, don't have to, there's no problem with social distancing. And even though I took my mask off for our interview today, when you walk in, you'll see that all of us are, masked, all the time. We're cleaning rooms in between visits. We're able, because I said we have like a lot of space, we're staggering the rooms that we use so that you're not going into a room that someone was just in. Always, I think we're, super vigilant about hand washing before and after every patient. Yeah, so I think that, we're doing all the smart things. And I think that everybody here is now vaccinated, thankfully. So the evidence is still out. We're all still watching the CDC guidelines, but certainly the idea of, our staff being, vaccinated suggests that, we're not gonna, we're highly unlikely to transmit COVID to anyone. And we're screening patients when, before they come in to make sure that we're not bringing anyone in who might have potential COVID symptoms.
So no matter what kind of care you need here at Christiana, it is safe to do so. Dr. Bittner Fagan, thank you so much for joining us. Is there anything you'd like to add before we go?
Just thank you so much for this chance to talk to people. I really, it would just bring me a lot of joy if there's a couple people out there who, move a little closer to getting their screening done.
Thank you. And thank you for watching this conversation today. If you have any more questions about ChristianaCare services, please visit ChristianaCare.org, as well as reference the links in the comments below this video. Thank you so much and have a great day.